Ever wondered how antibiotics work and how they are classified? Well, today, we're diving into the fascinating world of antibiotics, exploring their classifications and mechanisms of action. Antibiotics can be classified based on their mechanism of action and chemical structure. Let's start with the mechanism of action. There are two main types: bactericidal antibiotics, which kill bacteria like penicillins and cephalosporins, and bacteriostatic antibiotics, which inhibit bacterial growth, such as tetracyclines and macrolides. When it comes to chemical structure, there's a wide variety of antibiotics. This includes penicillins, cephalosporins, macrolides, tetracyclines, aminoglycosides, fluoroquinolones, sulfonamides, trimethoprim, and glycopeptides. Each of these classes includes different antibiotics, all with unique properties. Antibiotics also differ in their spectrum of activity. Broad-spectrum antibiotics are effective against a wide range of bacteria, while narrow-spectrum antibiotics are effective against specific types of bacteria. Antibiotics can also be classified based on their target site in the bacteria. For instance, cell wall inhibitors like penicillins and cephalosporins disrupt the bacterial cell wall, while protein synthesis inhibitors like macrolides and tetracyclines interfere with the bacteria's ability to make proteins. Now let's delve into the mechanisms of action for each class of antibiotics. Beta-lactams, like penicillins and cephalosporins, inhibit bacterial cell wall synthesis by binding to proteins in the cell wall. Macrolides, like erythromycin, bind to the bacterial ribosome, inhibiting protein synthesis. Tetracyclines, like doxycycline, inhibit protein synthesis by blocking the attachment of aminoacyl tRNA to the ribosome. Aminoglycosides, like gentamicin and amikacin, bind to the bacterial ribosome, causing misreading of the mRNA and inhibiting protein synthesis. Fluoroquinolones, like ciprofloxacin and levofloxacin, inhibit bacterial DNA gyrase and topoisomerase IV, enzymes crucial for DNA replication, transcription, and repair. Sulfonamides and trimethoprim disrupt the synthesis of tetrahydrofolic acid, essential for nucleotide synthesis. Glycopeptides, like vancomycin, inhibit bacterial cell wall synthesis by binding to the D-alanine portion of cell wall precursors. Understanding these classifications and mechanisms of action helps in selecting the most appropriate antibiotic for a particular infection. It's important to always consult a healthcare professional for accurate advice. In summary, antibiotics are classified based on their mechanism of action, chemical structure, spectrum of activity, and target site. Each class has a unique mechanism of action, which is crucial for their effectiveness against bacterial infections. Remember, antibiotics are powerful tools in the fight against bacterial infections, but they must be used responsibly to prevent antibiotic resistance. Always follow medical advice when using antibiotics. Thank you for joining us on this journey through the world of antibiotics. If you found this information helpful, please subscribe for more engaging and informative content. Until next time, keep exploring. Amoxicillin often comes to the rescue, effectively treating bacterial sinusitis, otitis media, and streptococcal pharyngitis. For lower respiratory tract infections, we have other champions. Azithromycin is the go-to for community-acquired pneumonia, while ciprofloxacin shows its prowess in tackling bronchitis and exacerbations of chronic obstructive pulmonary disease. Moving on to skin and soft tissue infections, cefalexin commonly battles cellulitis and skin abscesses. For more serious skin infections, clindamycin is usually the weapon of choice. Urinary tract infections see the use of trimethoprim, sulfamethoxazole for uncomplicated cases, while ciprofloxacin proves effective against urinary tract pathogens. In the realm of sexually transmitted infections, doxycycline is used against chlamydia and gonorrhea, with azithromycin often prescribed for chlamydial infections. For gastrointestinal infections, metronidazole is commonly used for anaerobic infections, whereas ciprofloxacin is the choice for bacterial gastroenteritis. Meningitis, a serious and potentially life-threatening infection, is often treated with ceftriaxone, a third-generation cephalosporin. and vancomycin for certain bacterial strains. Intra-abdominal infections often require broad-spectrum antibiotics like piperacillin tazobactam. Hospital-acquired infections, such as those caused by methicillin-resistant Staphylococcus aureus, are combatants for vancomycin, while meropenem, a broad-spectrum carbapenem, is used for serious infections. And lastly, in prophylaxis, cefazolin is often used before certain surgeries to prevent postoperative infections. Remember, the selection of antibiotics should be based on culture and sensitivity results whenever possible. The judicious use of these powerful tools is crucial to prevent the development of antibiotic resistance. This was a quick tour through the world of antibiotics and their clinical applications. Hopefully, this has provided a clearer picture of how these fascinating drugs are selected to combat different types of infections. Thank you for your time. Remember to subscribe for more content that unravels the intriguing realms of science and medicine. Stay curious and keep learning.